Texas Live on KETK. February is Heart Month.
And today we are talking with Dr. Tad Tolleson with Tyler Cardiovascular Consultants with the ETMC Cardiovascular Institute. Well, thank you so much for coming, Dr. Tad.
My pleasure.
Okay, so we're talking about how February is Heart Month, and also heart disease is the leading cause of death in the U.S. Why do you say that is?
Mainly due to the risk factors that put people at risk for heart disease. If you're talking about high blood pressure, high cholesterol, diabetes, like we were talking about off air, obesity and the epidemic of obesity and diabetes, those are the major things that put people at risk of heart disease. Those are also things that are prevalent across the social strata in our population, not just in America, but in Texas and specifically in East Texas.
How do you know that you have heart disease? Are there any symptoms that come with it?
If you're the unfortunate, let me take a step back. The unfortunate part is about 30 to 40% of people, their presenting symptom with heart disease is the day they have a heart attack. So in that group of people, they don't. And so that's why we're big on, like we're talking about today, making people aware of their risk factors and so forth forward. If you're fortunate enough to have some early warning signs or some symptoms, as you say, most people, or what most people think of is chest discomfort. I don't say chest pain because most people who have had it don't describe it as pain. They describe it as a pressure, a tightness, a burning, an uncomfortable feeling in their chest. You hear people say it feels like an elephant sitting on their chest, or somebody tightening a vise on their chest or blowing up a balloon in their chest. So they feel a very uncomfortable feeling in their chest. Sometimes radiates into their arms, into their neck. A lot of times makes them feel breathless and so forth. So those are kind of the typical signs that people see. And women unfortunately have those symptoms and also have some what we call atypical or unusual symptoms as well.
So if people don't have these symptoms but want to prevent things like that from happening, what can they do?
The biggest thing to do is to be aware of what your risk factors are. I mean, the obvious ones that we talk about the most are diet and exercise, because that's something that all of us need to do for our overall health anyway. And then the two other big ones that I talk to people about are your cholesterol and your blood pressure, because both of them are what I call silent killers, meaning if your blood pressure and your cholesterol are high, many times you have no symptoms. So those two things, if they're abnormal or going along in the background, potentially damaging your heart, doing things like that without you having any symptoms until you're late in the process. So getting them checked is paramount in terms of preventing things. If I saw people at your age who had high blood pressure, high cholesterol, you could prevent a lot of the things that happen down the road. And so those are probably the two biggest things that you wouldn't have symptoms from that need to be checked.
Well, I know with my own family, my dad had high blood pressure and passed it down to me. It just kind of ran through the family, but heart disease is genetic. So how can we, have a healthy heart life and live as great as we can with a balanced lifestyle with exercising and the right foods to eat?
Yeah, great question, because genetics does play a role, and everybody knows certain families where it seems like heart disease and strokes and so forth run in one family more so than others. Some people use that as an excuse and say, well, it runs in my family, there's not anything I can do. But almost everyone who develops heart disease has more than one risk factor. So just because you have a family history doesn't mean that you're destined to develop heart disease. And you can't do anything about your genetics. As I tell my patients, you're stuck with your family just like I'm stuck with mine. But what it means is to be more cognizant of your other risk factors and to be real diligent in terms of modifying those. So if you have a bad family history, then we want to make sure that your cholesterol and your blood pressure are well controlled. We want to make sure that you keep within a reasonable weight, that you get a reasonable amount of exercise, that your diet, and I don't mean diet losing weight, I mean food choices that we make to try to live a healthy lifestyle, that we pay even closer attention to those.
Great. And now, so if anyone has any questions about this information, or maybe that they have some signs and symptoms, what would you recommend they do?
The most important thing is to get in touch with your doctor. People always ask the question, well, my patients who have heart disease say, well, I'm never sure when to go to the emergency room or not. I tell them a couple of things. I tell them, if you're concerned about it and you're worried, go. And they say, well, I don't want to be embarrassed. I don't want to feel funny if I go up there and it turns out it's not. Nobody's ever died from embarrassment. I've been doing this for over 2 decades, and it's hard for me to tell if their symptoms are actually their heart or not, just talking to them like this. So I don't want them guessing wrong at home. We see people every day who die of indigestion, meaning they thought they were having indigestion, they stayed home, they didn't want to be embarrassed and come to the emergency room, and it was not indigestion, it was their heart, and they dropped dead. So even if they come to the emergency room, even if it turns out that it's not their heart, well, great. Now we reassure them so that when it happens again, they don't think something bad's about to happen to them. So in any event, whether it turns out to be their heart or not to be their heart, the right thing to do is to have it checked out.
All right. Thank you so much for those tips. We really appreciate it.
Thank you.
Thank you.
And when we